I am Dr. Ross, and today I'm going to start off by kicking it off with treatments that complement and enhance chiropractic adjustments. And then later, we actually got a roundtable is going to be at noon, and then at 1 p.m. we're going to have Joe and Alicia talking about some of the other adjunct therapies we have over here at the World of Wellness. I'm going to touch base on one of the new things that we got, which I absolutely love. It's called PEMF. It's called a cloud therapy. I'm going to touch base briefly about what entails with that, and then again, Joe and Alicia are going to go over that a little bit more at 1 p.m. They're going to talk about the Eligo scan, the cloud therapy, and the Zyto scan. So to start it off, treatments that complement chiropractic care. I think I'm just going to kind of back up, and at first we're going to talk about usually when you think of going to see a chiropractor, you think that you were just going in for either neck or any kind of low back pain. And a lot of patients usually think when you go see a chiropractor, all they're going to do is just adjust your neck or your low back. That is more of an old school kind of model. And over here, myself and Dr. Orbach, we look at everything as a whole, not just necessarily treating low back and neck pain. Actually, my first two patients, I guess my first three patients, one was a foot, one was an ankle, and actually we had two knees. So that's just goes to say that if you are having neck pain and low back pain, usually you think you go to see a chiropractor for that, but I see a ton of sports injuries as well. Someone rolls their ankle, having chronic knee pain that doesn't get better. They can't just basically live their lifestyle how they want. We have a ton of different things that we could do outside of the chiropractic and getting adjusted world that could kind of just basically aid in your overall well-being. So usually when you go to a chiropractor, you think you're just going to get neck or low back adjusted. And both myself and Dr. Orbach do a lot more than that. And the reason why is usually people say, you know what, I have some neck pain. I feel like I just need my neck popped or cracked to get a little bit of relief of my symptoms. While that does work, if we instill motion into a segment, so say we adjust your neck, right? So if you have a fixated segment, we are basically instilling motion into that segment. You are going to feel good, but that's only half the battle. The second half of the battle is treating the soft tissue component, because I like to tell patients, if we adjust your neck, and if you're working at a computer and you have tight upper traps, tight scalene muscles in your neck, if we just give you an adjustment, and if we don't treat the tendons, ligaments, and muscles that are attaching to different joints and segments in your body, we're missing half the battle. A lot of patients come in, they're like, yeah, I went to another chiropractor, they adjusted my neck, and I felt like it kind of it fell out, so to speak, a couple weeks following, and that could be that they just didn't do soft tissue, because again, if we instill motion into a segment, but you still have a tight tendon, ligament, or muscle that's kind of pulling on that structure, then it could kind of essentially kind of pull you out again. So I pride myself, as well as Dr. Orbach, on doing a lot of different soft tissue therapy. And that's the other misconception, again, that you think you're just going to go get adjusted. Our scope of practice is relatively wide, so not only do I adjust people, whether it's spine or extra spinal, I do a lot of stretching. We also do cupping, and we also do something called instrument assisted soft tissue mobilization, which is basically just a fancy word for kind of muscle work. Just because, again, if we only adjust you and we don't work on the muscles and stretch out tight structures and give you exercises to do at home to kind of strengthen weaker structures, we're missing half the battle. So usually in a treatment room would consist of, if let's just take since I'm a chiropractor, let's go low back pain, right? Someone's coming in with a hot disc in their low back, and I'll kind of go over the mechanisms of what's going on with that. But if we just adjust your low back, but we don't work on your hips, if we don't work on certain core stability muscles in your abdominal cavity, you're not going to get the full effect. And my goal when I see patients is, yes, I want you to get out of pain, but more importantly, I'm trying to restore your function, and that's a big thing for me, because yes, you're going to feel good and you're going to get out of pain, leaving my treatment room, but what do you want to do, or what is preventing you, whether it's pain, lack of function, what do you want to do that you can't do? And I have a lot of people, it's garden season, right? A lot of people coming in, yeah, I was feeling good, and then I started working in my garden, I'm having pain after working in the garden about 45 minutes to an hour, my knees hurting me, or my low back, or my hip. And basically what we'll do is we'll get you treated in the room. And then I'm a huge fan of like home care. So I give patients a lot of different exercises and stretches that they can do to kind of aid them so they don't have the same problem coming back. Um, we could do like basically scraping. That's what instrument assisted soft tissue immobilization. It kind of looks like a glorified butter knife. So what I like to do is I like to heat people up with the laser before, because most of the muscles, tendons, and ligaments in your body, they're all collagen based, right? And once you heat collagen up to around 100 degrees, it becomes a little bit more pliable or mendable. So when we actually heat the tissue up and then we go over with the Grasson tool, it's just going to loosen everything up a little bit more efficiently. Um, so we do different kinds of soft tissue work, whether it's PNF stretching, ART, which is kind of like a trigger point and release therapy, and then what I also like to do a lot is movement screens as well. So right now we're in the middle of golf season. It's July. And I love when I get someone coming in, avid golfer. They like to go play 2, 3 times a week. I love to take them through a movement screen to see where they're lacking range of motion, and so we could give you different exercises and correctional things you could do at home, so you could take a further backswing, so you're not losing posture, so your head's not coming up. You actually keep your head down on the ball. So we, again, me myself and Dr. Orbach, we look at every patient as a whole, just to try and get you to perform optimally as you can and function as clean as you can too. um, so with that, we'll just start with an example of again, being a chiropractor, we're going to start with the low back. So right now I'm going to show you a model of how basically I would assess and treat a patient with any kind of low back pain. So right here we have a model of your low back. So this is basically showing your vertebral bodies and then the disc inside. So what happens, and it's very, very common that I see patients coming in, hey doc, my back was hurting me a couple months ago, it kind of got better, I kind of warmed up, and now my back's hurting me again, and I'm kind of feeling it bleed or run down my leg, kind of goes into my glute region, my hamstring, behind my knee, your classic sciatic symptom. And so I'm going to describe to you what that is and basically how we treat that over here, and we get fantastic results. So if we're looking at it, if you could see, Phil, can we see this? Okay, so the red, that is the jelly inside the jelly donut. So that is called your nucleus pulposus, and then you have something called an annulus fibrosus. So we could just, the best analogy is the jelly inside the jelly donut. Depending on what you do for your occupation and lifestyle, a lot of people coming in with any kind of low back, like a disc bulge or disc herniation, it's not necessarily the athletic type. It's actually people who just sit all the time. So you have the most compression on a disc in the seated position. So when people were working like accountants, anybody working at a desk job, anywhere from 40, 50 hours a week, when you have all that compression on those discs, on the vertebra in your low back, it puts a lot of load on that disc, and then sometimes the jelly squeaks out of the donut, and then that's when you get your disc herniation. And when patients say they have a pinched nerve in your back, a pinched nerve and a disc herniation is kind of one of the same. So we'll call the jelly, we'll just call it inflammatory soup. There's 8 main inflammatory proteins that live in here, and when you have a disc bulge or a disc herniation, what happens is that chemical soup comes out and hits the adjacent corresponding nerve. I don't know if they could see on this model, but what happens is your disc actually, you can see it. Yeah, your nerve root corresponding with that segment actually swells 3 times its normal size. So when you go to an old school chiropractor for a treatment of a disc herniation, usually what they're going to do is they're going to put you on your side, they're going to adjust your back, and then you're out the door, you're on your way. That doesn't fly around here because we're treating basically 2 components. You have a physical component, which is going to be from the disc, and then you also have a chemical component from the chemical soup that leaks out and allows the nerve to swell 3 times its normal size. So usually what I do is first we do a full diagnosis to see what's going on. If you have an MRI or an X-ray, definitely bring that in. We'll get eyes on that too. But we treat the physical component by not only adjustments but some of the pinning and stretching. So what that means is if you have a hot disc in your low back, those muscles are going to get very hypertonic and kind of want to go into a spasm. So to alleviate some of the pain and just allow for you to function properly, we're going to release some of the tight tissue, and then we're going to stretch and get you adjusted. So that's kind of the physical component. Where we're different at the World of Wellness is we not only treat the physical, but we treat the chemical component as well. And what I mean by that is we were talking about the inflammatory proteins, that chemical soup. So if you have a disc bulge or disc herniation, that chemical soup is going to hit that adjacent nerve root. what I like to do in the treatment room is, and why I am so blessed and fortunate to be working at the World of Wellness is, we have a massive supplement store that can help with anti-inflammatory properties. So usually what I tell patients is, hey, you're going to feel better short term from this going on, but you're going to have to get on a natural anti-inflammatory. So my favorite, X Flame. Usually when I have someone with a hot low back, I say, hey, let's try 6 X Flames a day. I know that sounds crazy, but that's better than taking 4 ibuprofen a day. And usually I have them take it 2 to 3 times a day. So you could go three capsules in the morning, 3 at night, or you could break it up two, and two. And because you are going to feel better from the physical component that we do in the room. But until we get the chemical irritation out, you're still going to have your pain. You're going to still have that ridiculous symptom bleeding down your leg or running to an extremity. Same that goes with the neck. If you have too much compression in your neck and it's pushing down on that disc, and then you get the ridiculous symptom, we have to do things to kind of distract and open up your low back. So that's my wheelhouse in the room. But then I also try and advise patients that you got to get on a natural anti-inflammatory. And my favorite, again, is going to be the X Flame. If you're looking for joint support, Nutritional Frontiers makes it very, very easy. It's called HA Plus. So a lot of patients ask, Doc, I feel like the older I get, my knees are going bad, or now I'm feeling some creaks in my elbows when I'm working outside in the garden. And what can I take for a joint support? Nutritional Frontiers makes it extremely easy. They have HA plus, so it's hyaluronic acid, glucosamine, MSM, and chondroitin's also in there. So your top four for any kind of like to prevent the progression of arthritis or any kind of joint support, that is going to be your main one right there. So a lot of my patients, I would say 90% of them, I will treat them, they'll feel great, and then I basically coach them to say, to prevent the progression of anything happening, or to prevent the potential flare, to prevent a potential flare up, you got to get on the supplements. Because again, if we keep our inflammatory levels low, you're not giving your body anything to create inflammation and pain from. And how that also works too is diet, lifestyle. We have Alicia here. She's a functional nutritionist, and she sits down and she'll walk basically from breakfast all the way before you go to bed and see if you're eating anything pro-inflammatory in your diet. Again, we can't just chase the pain and chase the symptom and, hey, let's adjust your back and send you on your way. You're not going to make a full recovery. Chances are you're going to have to modify your diet temporarily and eat less carbohydrates. And Alicia's great on kind of coaching and telling you what foods that you could eat that are not going to be pro-inflammatory, so you're not creating inflammation, so you don't keep having this flare of this disc thing going on. What I also like to do too is, if you meet with Alicia and you get your diet all squared away, and I'm treating you in the room, you're feeling better and better, but you're still like not you're 85 to 90% better. But hey, doc, I feel like I'm almost there. I just feel like I can't get over that last hump. Usually I'll order lab work, and if I order lab work and everything comes back clean, usually when I order lab work, you're going to be deficient in a couple different vitamins and minerals, and that's really easy because this is a nice objective measure to kind of see what's going on with your body, your biochemistry. Because if you have a high, let's say high sensitivity C-reactive protein, so a high inflammation in your body, you are going to feel better, but you're not going to make a full recovery because you're still stemming inflammation. So your disc isn't going to heal. So there's multiple pieces of the pie. Is I guess the point I'm trying to get across is yeah, we're going to treat you physically in the room, but unless you make any kind of dietary changes, lifestyle changes, start taking some supplements to decrease your inflammation, you're not going to get as good as you can. You're not going to get a fully optimal result. Also, what I like doing as well, if patients are kind of skittish with the lab work, hey, I don't like needles, I don't want to go get lab work, we have something over here that's really, really cool. It's called a KBMO Fit Diagnostics Test. And essentially what that is in a nutshell is, that is basically a food inflammation panel. So say you meet with Alicia and you kind of go over your diet, we modify it, and you're eating less pro-inflammatory foods, but you're still stemming inflammation. Say we order lab work and you still have a high, still an elevated HSCRP. What we could do then is we could actually order you a KBMO diagnostics tool, and it's basically checking what foods are inflammatory for your body. And my favorite, if you're going to get the fit test, you might as well get the one that's 176. So it tests 176 different foods, additives, vegetables, fruits, different meats, different sugars, checks yeast, brewer's yeast, and basically it will see what your body is going to create inflammation to. And the cool thing about having the KBMO Fit Diagnostic Test is, there's something called zonulin, and zonulin is a great measure to see if you have any kind of leaky gut. So see if your microvilli in your gut are permeable. This is actually the first one in the country that I think got the patent for the zonulin test. So it truly sees if you have leaky gut, because again, if we're treating your physical symptoms, but you have something underlying going on, yeah, you're going to get temporary relief, but you're not going to make a full recovery. So it's basically looking at the patient as a whole, not necessarily just the physical mechanism, like what I'm treating in the room. We got to put out all the other fires in your life as well, whether that is, just like we were talking about. If you go out on the weekends, you kind of go off the rails, and you're crushing pizza every Friday night. What happens if we send you for a food allergy test or a food inflammation test, and it comes back that cheese or any kind of dairy products are highly reactive in your body? So you think that you're having your one cheat meal, but your cheat meal is basically on steroids because your body's creating a ton of inflammation towards that. So again, we have to look at the patient as a whole, and not only treat you physically in the room, but biochemistry and what you're putting in your body, your lifestyle, your sleep. That's all vital too, so you can make a full recovery. And so that's basically what I like to do if someone's having something inflammatory. So if we're talking about a disc herniation, if you're talking about a tendonitis, like a tendinopathy, so very common one, Achilles tendonitis. A lot of people, they're running outside active now due to the nice weather. Doc, my Achilles is killing me. What can I do for it? Well, here's the gold standard take home exercises, stretches you could do at home. We're going to treat you in the room. You're going to feel great. But if you're putting stuff in your body that's inflammatory, you're going to keep creating inflammation. And that Achilles tendonitis, the suffix of that word being itis means inflammation. If you don't get on a natural anti-inflammatory like turmeric, bromelain, quercetin, the X-Flame, the Inflam, you're still going to have residual inflammation, and you're not going to make a full recovery. So I cannot emphasize that to patients enough. Yes, we treat you in the room, you're going to feel better, but just to prevent anything from flaring back up and to ensure that you make a full recovery, you got to probably change your diet, your lifestyle, and get on a couple supplements to suppress your inflammatory response to any kind of injury you got going on. And so that's basically in a nutshell how we treat any kind of tendinopathies or any kind of inflammatory things going on. So what my favorites again, X-Flame, HA plus, and then we're getting a lot of good results with the topical transdermal, the lipodermal CBD. So Nutritional Frontiers, they make a fantastic CBD. And why does it separate itself from other different CBDs on the market? Here's exactly why. If you have any family members or loved ones, or anybody that they're female, they go through menopause, and they're kind of just feeling sluggish, tired, and they let me go to an endocrinologist, see how my hormones are. Sometimes endocrinologists will give their patients a cream to get your hormones. So for example, if you're deficient in estrogen or progesterone, your endocrinologist will say, "Hey, I'm going to give you a cream twice a day topically. You're going to rub the cream on your skin, and you're actually going to get your hormones in that way." And then you don't actually have to worry about the first pass effect through the liver. So you're actually getting all those hormones in. Nutritional Frontiers uses the same lipodermal technology, and so I always tell patients, like, this isn't a placebo. This is legit. Pharmacists compounded this molecular structure so it actually gets through your skin and into the target tissue as desired. So if we're talking about an Achilles tendonitis, if we're talking about golfer's elbow or tennis elbow, lateral epicondylitis, I get massive results in the treatment room with our transdermal CBD because it is not a placebo. And CBD in its nature is an anti-inflammatory and a neuroprotectant. So when we put the CBD over certain soft tissue structures based on the compounding structure, the molecular formula from the transdermal CBD, Nutritional Frontier CBD, it truly gets into the target tissue and will decrease inflammation drastically. So CBD in its nature is a natural anti-inflammatory and a neuroprotectant. So we're going to treat all the physical symptoms of your Achilles tendonitis in the room. But again, I'm going to highly advise that you get the topical CBD just to kind of nuke the residual inflammation. And then we're going to work systemic. So then you got to get into your body too, right? So whether you want to do the sublingual, so we have CBD that you could put under your tongue, hold for 20 seconds and then swallow, or you could get on a natural anti-inflammatory like Inflam, X-Flame, or turmeric. And usually patients are going to make a full recovery from that if you do your homework at home. I'm a huge advocate of giving patients home exercises and stretches to do because there's only so much we could do in one or two treatments a week, right? So I always say when patients come in, hey, did you do your homework? Do you try this exercise, this stretch? And you better be trying them because we need to see if you're going to make a full recovery or not. So that's kind of in a nutshell how we're going to treat some of that stuff. But some of the other passive modalities we have here, and what I mean by a passive modality is you're basically not you're basically just having a machine, or you're having some kind of modality do something to your body to increase your naturally healing capacity. So everything that we do, myself and Dr. Orbach in the treatment room, is all going to be active, but the passive modalities, we have a couple really good ones. So we have an infrared sauna. A lot of patients ask, Doc, what differentiates an infrared sauna from a conventional sauna? Well, a conventional sauna, kind of think of it as an oven. So the temperature is going to be a little bit hotter, anywhere from around like 150 degrees to 200 degrees, and it's actually going to heat the air around you, not necessarily your tissue. Why we have the infrared sauna and why patients get great results from the infrared sauna is, think of it as a microwave. So the microwave, how it heats your food is it actually kind of heats up the water molecules inside the food. What the infrared sauna is going to do is it's actually going to heat up your tissue, so heat your body, and it's going to allow for that all that detoxification properties that go along with it. Why I also like the infrared sauna too is it is not as hot. You could go anywhere from around like 125 to 150 degrees is what I recommend, anywhere from 30 to 40 minutes, and that's going to have a massive detoxification purpose. Another cool fun fact about the infrared sauna is there was a study that came out, this was about 5 years ago, and they compared people who exercise compared to people who did not exercise. And they actually just sat in an infrared sauna 3 times a week for 30 minutes. And this was actually in Finland, and this was in Finland and Sweden. They did this study, and what they found was, if you sit in an infrared sauna for roughly 30 minutes, 2 to 3 times a week, it's basically mimicking cardiovascular activity. That is absolutely massive, because everybody knows, has a family member or a friend that cannot exercise due to they're morbidly obese or double knee replacement, or they just can't get the motivation to kind of get up and start exercising. Obviously, that's going to do a ton of damage on your heart, right? If you're not using your cardiovascular system. So if you have any family members or friends or loved ones that cannot exercise due to, whatever's going on in their life, if you actually have them sit in an infrared sauna, it's going to mimic cardiovascular activity. So that's one of my favorite ones over here. Not only do you feel good and you're going to detox after, but it's actually going to kind of help with your heart. Another thing that really helps, when we were just talking about the Achilles tendonitis or tendinopathy, we have something called a Normatec compression boot. So that makes my job a lot easier. That is definitely a treatment that complement the chiropractic adjustment. And what I treat in here, if it's any kind of lower extremity thing going on. So if you have any kind of swelling, edema, or just like tight muscles or pain in your legs, what the Normatec compression boots do, it basically just looks like a huge blood pressure cuff that goes from your foot all the way up to your groin, and it works on something called pneumatic compression. And so what is pneumatic compression? A good comparison is, there's two different types of people. When you wake up in the morning, you're brushing your teeth. Some people just kind of squeeze their toothpaste, and if they can't get any more out, they're like, that's done. They'll throw it away. And then you got people like myself that, okay, well, I think I could get a little bit more. Let me kind of just like inch everything from the back and get it all the way up. Let me kind of roll it so I could get literally everything out of this tube of toothpaste before I throw it away. That's basically what pneumatic compression does. So that is compared to the compression therapy, like the socks that you wear. So a lot of patients, Doc, do I need to get on the Normatec compression boots? I already wear compression socks. Yes, you do, because they're different. Compression socks are going to kind of just be like, yeah, you have your last squeeze of the toothpaste, you throw it away. But basically the Normatec boots with the pneumatic compression is basically going to squeeze everything out, like literally get all the lactic acid and all the metabolic waste out of your legs, goes through your lymphatic system, gets to your vital organs, gets highly oxygenated and nutrient dense. So then when you get your blood flow back down to your legs, you get all the good healing factors. Actually, the Normatec compression boots were actually studied by the FDA for treatment of stage 1 varicose veins. And anybody with any kind of knee pain, if you have Achilles tendonitis, if you sprain something in your knee, actually post surgery, if you tore MCL, ACL, meniscus, anything like that, if you get in these compression boots, what they basically do is they're going to push all the lactic acid. And every time you move, your cells create waste. So it's going to basically push all the faulty metabolites out of your legs. So when that blood goes back down to your legs, you have a full recovery and you feel a lot better. I usually tell patients it's like kind of getting a fresh set of legs. You just feel a lot better after that. And those are my favorites to usually use Tuesday. Usually I exercise legs on Monday. So Tuesday at lunch or after work, you'll definitely find me sitting in those just to kind of flush everything out of my legs. Another one that we have relatively new, we have something called vibration therapy. And Bobby over here calls it the shake machine. So essentially, it's like basically a big pad that you stand on and it just vibrates. And there's different frequencies. And why that's important, it really helps with lymphatic drainage. So if you have any kind of lymph problem going on, or if you feel like you're getting sick, if you actually stand on that vibration plate, it's going to help drain your lymph and move your lymph. So it's just not sitting and just basically, yeah, just sitting in a certain spot in your body. So I like the vibration therapy for athletes because it will actually help enhance your stretching. So if you got someone coming in and you sitting at home, if you're like, man, my hamstrings are always tight. I've tried X, Y, or Z. I've tried all these different things. My hamstrings are still really tight. I would highly advise you come in, get on the schedule, and get on the vibration plate, because if you're standing on that vibration plate, when you go to stretch your hamstrings, when you just have just a little bit of an oscillation movement, it's going to allow you to kind of go a little bit deeper. And when you actually hold that stretch around 40 to 45 seconds, it's really, really going to help to loosen up your hamstrings. So that is basically used to help loosen up tight tendons and tight ligaments. If you stretch on the vibration plate, it's going to help with lymphatic drainage. And then there was actually another study I just read a couple weeks ago that said it aids in weight loss. Who doesn't like losing weight? I feel like everybody likes to find little cheats and tricks to kind of aid in weight loss. So that actually helps in that as well. And then the last passive modality that I'm going to talk about that is really, really just makes my job a lot easier, not only with, ordering lab work, with the laser treatment we got, with the topical CBD and the X-Flame from Nutritional Frontiers. But we also just got about a month and a half ago something called a cloud therapy. And again, Alicia and Joe are going to kind of dive in a little bit more at 1 p.m. about it. But what is PEMF? So PEMF stands for pulsed electromagnetic frequency or field, depending on what study you read. And my explanation of PEMF therapy in a nutshell is it is basically going to recharge the battery in your cells. So just very generally speaking, you have something called a resting cell membrane potential, and it's different for skeletal muscle, different organs, different, your brain, liver. They're all different resting membrane potentials. But in a nutshell, it's usually around -70 millivolts. We'll just take that. That is going to be like the main resting membrane potential compared to everything in your body. When you have disease and pathology, when that spreads, it's basically because your cell membranes become leaky, so they get closer to zero. So they get closer to like -25, -20, and on their way to zero. That's when disease and pathology spreads. Why the PEMF table is massive for a lot of people dealing with any kind of, more specifically autoimmune conditions, is one of the favorite ways I like to use it on patients. um, when you get it on a PEMF, it basically donates electrons to your body to negatively charge that resting cell membrane potential. So what that means is it's going to take your -70, or if you had an injury or pathology, autoimmune condition going on, you're getting closer to positive, right? So this is essentially going to charge your cells more negative, so around like -85, -90. And so disease and pathology cannot spread. There's actually a really cool study that they had a woman, she had lung cancer, and she had a tumor in her lung, and she was actually getting on the PEMF table once a day for an hour. Yes, 7 days a week in an hour session a day. And the theory behind that is if you charge the adjacent cells membrane, and basically make that resting cell membrane potential a little bit more negative, disease and pathology cannot spread to the adjacent cells. So I thought that was very, very cool. And basically, the first study and how I learned about this was actually NASA was using it. So NASA, when they went up into space, if they were going to be there for months on end, they actually started to incorporate putting the PEMF. It's basically a mat you lay on. There's a mat for the whole body, and then you have a smaller mat for localized areas. But they were actually putting that in the space station because they were losing bone density. And so they were thinking, well, what can we do to basically just kind of recharge the battery, so to speak? And they actually and ended up putting that on the NASA aircraft. So I thought it was actually pretty cool. So that's where that kind of came from. Again, it's going to help to recharge the battery of your cell just so any kind of disease or anything cannot spread. And again, Joe and Alicia are going to touch base a little bit more, but that's what I think it does in a nutshell. And then it also helps with microcirculation too. So if you have a specific injury, say you say you fell and broke a rib, obviously it's not going to be wise to come see me. We're not going to adjust you. That just absolutely makes no sense. But what you can do is we could do the class 4 therapeutic laser to kind of help the chondroblasts. So chondroblasts basically are cells that kind of like help you grow bone. We could basically laser the area where you had your fracture or your broken rib. And then after I'm done with the laser treatment, you could go over and sit on that PEMF table because it's going to help with microcirculation. So it's going to bring even more good blood flow to the area, your natural stem cells to the area. So you could heal basically 100 times quicker than what you normally would. So I actually just, unfortunately, we ran lab work for one of my patients about 2 weeks ago, and we found she has rheumatoid arthritis. And not only are we lasering her and treating her, just a great example. She went and met with Alicia because when her blood work came back, her inflammation levels were through the roof. So what I did was we treated her symptoms. She was having kind of multi-joint symptoms, got those all treated, kind of cooled out the fire, and then we had to get her on a natural anti-inflammatory, right? So I got her on the X Flame, and then we also got her on the HA Plus for the joint support. But again, most immune system, like autoimmune stuff, if we think immune system, we got to think gut, right? So that's why I had to get over with Alicia, because Alicia's now working with her to kind of heal her gut. She has leaky gut. So we're going to try and heal her gut so her immune system's functioning more properly, so she does not have as of great flares of her RA symptoms when she has them. So that's kind of like what we do around here. It all the different passive modalities and all the adjunct treatments make my job a lot easier. I love treating people. I love stretching people. I love doing all the tissue work. But if I don't have some of these different passive modalities, like the laser, like the cloud therapy, shake weight, Normatec boots, it just makes my job a lot harder, and people are going to get a lot greater results if they could use the adjunct therapies in conjunction with what we're doing in the treatment room. So I like to think of this honestly kind of as like a one-stop shop. So if you need lab work, so again, say you had knee pain, your knee pain's feeling better, but it comes back in a couple months. Come in, and we could see if lab work's going to be right for you. We could either order lab work to see if you're creating inflammation, see if you're off a little bit. We could even get you on that KBMO fit diagnostic test. So we could actually have you take that test, and it's actually blood. It's just simple finger prick. It's not like intravenous. It's not like getting lab work, but we could see what your body is actually creating inflammation towards and kind of remove those from your diet so you're not creating inflammation. And then you could also meet with Alicia. So Alicia's, again, she's going to go over what you're putting in your body from basically when you wake up to where you go to bed. And if you're eating anything inflammatory, how that's basically going to prevent you making that like a full recovery, and you're not going to be as optimal as you can. So if anybody wants to come in and check out any of these modalities, I think we're actually putting people in for free this week, if I'm not wrong. I hope I said that right. I don't get in trouble. And 15-minute consult. So we're gonna make sure that all the modalities are safe for you, and then if you want to come out and sit in the infrared sauna, if you want to try the Normatec compression boots, if you want to try the cloud therapy, which I highly suggest, come in, check it out, and then the results speak for themselves. So everybody, once they try these, and especially after they leave the treatment room, you're gonna feel great. You're gonna feel 100%. So I would say come on down, and if anybody has any questions, my lunch is every single day, 1 to 2 p.m. I am getting crazy booked. I promise I'll try and call the day of, at least the week of. But if everybody wants to kind of pick my brain, hey, I got this going on, or my sister has this, or my son's dealing with this, bring them in. We'll take a look, see if any of these modalities are right for you. Again, we are basically essentially trying to do everything to increase your healing capacity so you're functioning as optimal as you can. I love working with athletes, but I also like working with people that are just very active lifestyle as well. So come in, and if you have a thumb bothering you, right? Working on a guy right now, big garden guy, and his thumb's been bothering for years. Never got it looked at, never got it taken care of. Didn't want to go to a doc. He came in here. We've been working on his thumb. His thumb's feeling a lot better. And actually, he was in last week, and he was like, you know what? Like I was doing something, and usually when I was gardening, or I was using tools in the garden, the whole time I was using them, I felt my thumb. And I was always cognizant. It always hurt me. And now when I'm in the garden, I'm actually grabbing things, and yeah, once every now and then I'll kind of have like that sharp pain. It only lasts about a second or two, and then I'm back to normal. I didn't even think about it when I was in the garden the other day. So that's what I like, and that's why I'm in this profession. I love when people do things that they love to do, and then whether it's an injury or trauma or just insidious onset, they started having pain and they can't do things they like to do. I love troubleshooting and seeing what is basically stemming that, and why you can't do what you want to do, getting you feeling good. So if you want to be able to get on the ground and play with your 2-year-old grandson, I love basically trying to get you pain free and basically increase your function, so you don't have to think twice, or you don't have to think, man, if I play with my grandson on the floor, I'm going to be paying for it tomorrow. Not necessarily. We're going to get you feeling 100%, and then I'm going to give you great basically rehab exercises and stretches you could do at home. So when you're basically on the ground playing with your grandson, you're not scared of the next day or hurting yourself. And basically, I love improving people's quality of life, and I'm a big goal oriented guy. So whatever goals that you want to do, whether it's work related, right? I can't do certain things at work because of pain or dysfunction, or, I like having fun doing, kayaking, or, whatever activity you like doing, but you can't anymore due to either pain or dysfunction. I love troubleshooting that and getting you back to the life you want to live. So that is my Monday morning spiel. Again, if anybody has any questions, feel free to call. My lunch is 1 to 2, and I could talk to you either there or after hours, and we could kind of see what's going on, and see if you need to come in here and get looked at. So next we have the round table is going to be Joe and Alicia. They're going to be at noon, and then they're going to be talking. They're going to actually be doing a live demo of the Zytoscan, Aligo scan, and the cloud therapy. That's going to be coming up at 1. So until next time, guys, I think next time is going to be Friday at 1 p.m. I think myself and Dr. Orbach are going to kind of do a little bit of like things you could do at home, stretching, and basically just posture related things that you could do at home. So tune in Friday the 21st at 1, and we'll see you guys next time.